I'm Connie Franklin. I'm here with board certified plastic surgeon Dr. Bajaj here in Oklahoma City. And I wanted to talk a little bit about anesthesiologists and your philosophy on that in your practice.
So in my practice, we only use board certified anesthesiologists, and that's important for a number of different reasons. First of all, as a surgeon, if and when I do have surgery, I want an anesthesiologist. And I've made that request in the past because I have had surgeries performed on me at institutions that primarily use nurse anesthetists. And I've actually put the request in to get or have an MD anesthesiologist do my anesthesia. And these facilities have complied. So I think it's important to know that patients can ask and they should ask.
Be an advocate for yourself.
Yes, so be an advocate for yourself. And the other reason why I only use board certified anesthesiologists is, and it's the same thing I tell patients about why you want to go to a board certified plastic surgeon. If things go smoothly and you're healthy and you're relatively easy, chances are things are going to be okay. But if something happens that's unexpected, or if you have multiple other medical problems, you want somebody who is able to determine what needs to be done pretty quickly. Mm-hmm. And that's true in the anesthesia realm in the OR because things can get critical very rapidly. The other reason why I like to have board certified anesthesiologists is I want to focus on your surgery. And I want them to focus on your anesthesia and your heart and your lungs and all that other stuff that's really important with regards to keeping you alive.
For the general public, how did this happen? How are nurses doing anesthesiologists?
Well, it started primarily because there was a shortage of anesthesiologists, and there continues to be a shortage of anesthesiologists. And so the thought was, well, let's just train some nurses to do it. And typically they have in the past worked under the supervision of an MD anesthesiologist. But that's been rapidly changing over the past several years in a state-by-state fashion, where many nurse anesthetists have been seeking the legal ability to practice independently without an anesthesiologist supervision. And that varies from state to state. The other reason why sometimes you'll have nurse anesthetists is because they're less expensive. So in many hospital systems, it's more cost effective for them to have, for example, one MD anesthesiologist who supervises a certain number of nurse anesthetists. And the number of nurse anesthetists that he or she can supervise is also based on legal issues.
What does this mean in your private practice?
In my private practice, I get to control things. So it's my operating room. So I'm the one that's doing the surgery, and the anesthesiologist is the one who's doing the anesthesia.
And what are the benefits to your patients because of your position on this?
From my patient's perspective, I hope they understand that I have a focus on their safety and their well-being because I think they're better cared for in this way.
And I like how you mentioned because it's something you would want, right? So what's good enough for you is good enough for them.
Right.
And
I'm not going to cut corners for my patients.
All right. Well, thank you so much for covering that. I think it's a little bit of a hot topic, and there can sometimes be some misinformation or just a little bit of ignorance on the topic. Well, I hope that helped clarify a lot of things when it comes to anesthesiologists. And when you're looking at different practices, knowing kind of Dr. Bajaj's philosophy on not cutting corners. When you see that line item, if that's a little bit higher, know that you're getting a board certified MD and you're always going to be in the safest hands with us. Thanks for watching. Now do me a favor, hit that like button and subscribe.